Singapore provides an example of a government-run healthcare system that is simple, cost-effective, and produces optimal results. Why can't the US adopt a similar system? I think there are three primary issues. One, the most obvious reason, which came up in Reed's documentary, is that capitalism is at the core of the US's values. The free market ideology is so deeply ingrained in our society that a one-size-fits-all system would be a hard pill for Americans to swallow. See what I did there? Secondly, healthcare in the US has become deeply politicized. Although it is a reasonable topic to explore and discuss, harmful rhetoric exists on both sides of the argument, which prevents progress from being made. The liberal majority seems ready to consider the idea of universal healthcare, while conservative political figures tend to want the government to have less involvement in healthcare. This political divide has been present for decades with little interval progress. Thirdly, the transition process from the current system to any other system would be difficult to manage. Even on a much smaller scale, the rollout of Obamacare was wrought with technological failures and legal challenges, which made things significantly more confusing for Americans. It is likely that there would be similar challenges for a total overhaul of the American healthcare system. I suspect that the easiest way to ameliorate some of these problems would be to have the Democratic and Republican Party policymakers come together and discuss meaningful nationwide healthcare reform that compromises on the preferences of both sides. I suspect that once policymakers are willing to have that honest discussion, there could be at least a hybrid healthcare system that is mostly public, some private, that could produce better health outcomes. Finally, moving to a model like Singapore's would greatly simplify my job as an emergency department pediatrician. When a patient with a complicated medical history comes in, I often have to rely on the parent's recollection and interpretation of their child's previous history, because not all electronic health records communicate. Things that require precision, such as an exact radiographic finding or complicated treatment regimens, can easily be found when EHRs communicate, but they can be difficult to track down when they don't. For example, consider a patient that has had an extensive and complicated workup for a specific symptom through their primary doctor, and then they come to the emergency department due to worsening symptoms. If I can't access the tests that were previously done, I often have to repeat them, leading to unnecessary spending on the part of the patient. This would all be simplified if qualified practitioners could easily access health information in a universal system, as well as a universal electronic health record.